you're doing a health assessment of someone with atrial fibrillation and right-sided heart failure, you may find that they have some similar things that they've been experiencing. They may both have been experiencing some dyspnea, some fatigue, maybe some nausea, and in some cases, those with atrial fibrillation have had no symptoms at all. Those with right-sided heart failure may have been experiencing some weight gain, maybe some nocturia, some edema, ascites, which is the enlarged abdomen, that sort of thing would be found in the health history. When assessing the physical findings of someone with atrial fibrillation and right-sided heart failure, you may see some tachycardia, obviously the ascites again, hypotension, irregular pulse rate. You're going to maybe see some pale, clammy, cool skin, diaphoresis, and maybe some S3, S4 heart sounds, which are those irregular heart sounds. I'm going to start my assessment on my patient with atrial fibrillation and right-sided heart failure by looking at the posterior chest. I'm looking at how the chest is expanding, how it's moving, is it equal? I'm also looking at the respiratory rate and the breathing pattern. I'm going to listen to his lung sound starting at the top above the scapula, right there at the first intercostal space. And someone with these cardiac conditions, you may hear crackles, rhonchi, or wheezing upon expiration. So I'm going to assess those sounds, asking the patient to breathe in deeply and exhale on each side. And we're going to go all the way down. Next, I'm going to check for symmetrical expansion of the lungs. I'm going to use my thumbs and pinch the skin right at the spine in between about T9 and T10. I'm going to ask the patient to take a deep breath, and my hands should rise as he takes that deep breath, showing that he has symmetrical expansion of both of those lungs. I'm going to check for spinal tenderness. I'm going to do this by placing my hand where the spine meets the rib cage and then hitting the back of my hand with my fist and asking if the patient feels any tenderness in that area. Next, I will listen to the anterior part of the chest by asking the patient to move towards me, please. Again, I'll be assessing for any wheezing, any rhonchi, any crackles. This patient may have a cough with pink frothy sputum as well, so we're going to be assessing for that. I'm going to start here at the clavicle, above the clavicle at the first intercostal space, and ask the patient to take a deep breath. And then again, and then out, and then we'll go all the way down at each intercostal space. So for the cardiovascular assessment, I'm going to be checking for capillary refill, making sure that it is less than 3 seconds. A patient with these cardiovascular diseases may have cyanotic nail beds. They may also have some clubbing due to loss of oxygen. I'm going to assess the patient's skin turgor by pinching a piece of the skin and making sure that it goes back down, and it does. He's not. So when assessing these heart sounds, I'm going to be listening for any irregular sounds like an S3 or an S4, which could indicate the right-sided heart failure. That could be a possible indication. So next, I'm going to find the point of maximal impulse. And this is found at the 5th intercostal space, midclavicularly. When assessing the pulses, someone with atrial fibrillation may have an irregular pulse. So we're going to assess the radial pulse, and we're going to feel for this for 60 seconds. A patient will most likely be tachycardic with a pulse rate over 100. And then we would also assess the brachial pulse for 60 seconds as well. So in a patient with right-sided heart failure, you're most likely going to be seeing ascites in the abdomen. This is obvious due to abdominal distension, maybe an inverted umbilicus. You would also maybe see that they're having some trouble breathing when they're lying flat on their back. You're going to look at their abdomen, and then you're going to auscultate it in each of the 4 quadrants. You're then going to percuss the abdomen. Then you would palpate the abdomen in each of the 4 quadrants and ask if there's any pain or tenderness.